Assalamu alaikum. Welcome to Journal Club of this week. It is a CBCT study of proximity of maxillary molar palatal roots to adjacent structures for endodontic microsurgery. It is done by Chinese group and published in 2025 in BMC Oral Health. Although studies on the distance between maxillary molar roots and cortical plates most focus on individual root observation without addressing the positional relationship between buccal and palatal roots or analyzing the surgical pathway of maxillary molar palatal roots. This study utilized CBCT to observe the anatomical characteristics of maxillary molar roots, analyze the proximity of the palatal root to the cortical bone surface and the maxillary sinus floor, and provide a reference for endodontic microsurgery of palatal roots. They viewed CBCT taken between 2021 and 2022, and they segmented and 3D constructed the first and second maxillary molars. The examination of the segmented structures and subsequent measurements were conducted by two calibrated endodontists using serial axial, coronal, and sagittal CBCT images. They measured number of roots, root morphology, distance between buccal roots and palatal root, and the distance of palatal root to the cortical plates, both buccal and palatal. They created a classification of palatal root relationship to maxillary sinus floor. Type 1A, root apex plane was lower than the maxillary sinus floor. Type 1B, root apex plane and maxillary sinus floor were on the same plane. Type 2A, root apex protruded into the maxillary sinus, and type 2B, root apex did not protrude into the maxillary sinus. However, the root apex plane was higher than the maxillary sinus floor, meaning there is a pneumatization of the maxillary floor into the trifurcation of the molars. For the result of 500 teeth, 1,352 roots were evaluated. Buccal roots obstruction 3 mm from the palatal root apex were present in almost all maxillary molars. When measured through the mesobuccal roots, the distance to the buccal cortical plate was significantly shorter than that through the distobuccal root in the first molars. However, the opposite was observed in the second molars. The average distance between the palatal root to the maxillary sinus floor ranged from 1.9 to 3.6 mm, and females had significantly longer distance than males, with no significant differences between the left and right sides. The proportion of type 2B cases in the palatal roots of 3-rooted maxillary molars was significantly higher than that in the mesobuccal and distobuccal roots. The distance from the root apex to the maxillary sinus floor increased with age and was significantly longer in females than males, and the average distance between the apex of palatal root to the buccal cortical plate was 10.12 mm for the first molars and 10.53 mm for the second molars. The average distance from the palatal root to the palatal cortical plate was 1.95 mm. In conclusion, understanding the anatomical profile of the palatal roots of maxillary molars and their relation to adjacent anatomical structure is beneficial for pre-operative difficulty assessment and selecting optimal strategies and preventing complications.